Hi everyone, welcome back. This is part 2 of the video series 7 Toxic Supplements.
Vitamin E. Strong antioxidants like this one are crucial for cellular, vascular, and immune system health. Green leafy vegetables, wheat germ, nuts, seeds, vegetable oils, and fortified foods, think morning cereals and margarine, are good sources of it. Vitamin E has an RDA of 15 mg per day and a AUL of 1000 mg per day for both natural and synthetic supplements, 1500 IU per day for natural supplements and 1100 IU for synthetic. Alpha-tocopherol is the name of the natural form of vitamin E, and D-alpha-tocopherol is the name of the synthetic form. Mixed tocopherols are a common name for supplements. Vitamin E supplements may be necessary for those whose gastrointestinal conditions prevent them from absorbing fat. However, taking too much vitamin E supplements can raise the risk of bleeding since they can decrease the blood's ability to clot, which raises the possibility of bleeding. For those who take blood thinners like warfarin and Coumadin, this is especially concerning. Vitamin K. Vitamin K is a fat-soluble vitamin that plays a vital role in bone health and blood coagulation. It can be taken as a supplement and is present in green leafy vegetables. Since most people get plenty of vitamin K from their diet and rarely experience deficits, most people do not require a supplement. Those who have undergone bariatric surgery, as well as those suffering from cystic fibrosis, celiac disease, ulcerative colitis, and short bowel syndrome, are more susceptible to low levels of K. When there is not enough data to determine an RDA, the daily reference intake, DRI, for vitamin K is set as an adequate intake. Intake at this level is presumed to achieve nutritional adequacy. For men 19 years and above, the daily dosage is 120 mcg, while for women, it is 90 mcg. Vitamin K has no established upper limit of toxicity since the evidence of toxicity is weak. Those on specific drugs, such as blood thinners, shouldn't use vitamin K supplements, though. Furthermore, in certain situations, consuming too much may result in allergic reactions and may be harm to the liver. Vitamin B6. Water-soluble vitamin B6 is involved in numerous enzymatic processes, such as immune system response, protein synthesis, and cognitive function, to mention a few. Numerous foods, including fish, beef, organ meats, fortified foods, starchy vegetables, and fruit, contain it. Adults between the ages of 19 and 50 should consume 1.3 mg of vitamin B6 each day. The 100 mg daily AUL is far less than levels linked to side effects. When 1 to 6 grams of vitamin B6 are taken for 12 to 40 months, there is a correlation with sensory neuropathy, numbness and tingling in the hands and feet. However, this effect normally goes away after the supplement is stopped. Along with nausea and heartburn, long-term excessive consumption may also make you more susceptible to sunburn. Iron. A mineral called iron is necessary for the production of hemoglobin. It is essential for cellular function, oxygen transfer, physical and neurological development, and muscle metabolism support. Food contains two types of iron: non-heme iron, which is found in plant foods like nuts, seeds, whole grains, and legumes, and heme iron, which is derived from animal goods like red meat. Heme iron is more easily absorbed by the body due to its increased bioavailability. Males aged 19 to 50 have an RDA of 8 mg of iron, whereas adult women have an RDA of 18 mg. Pregnancy and lactation increase the need for iron. An iron supplement may be beneficial for those with iron deficiency anemia, strict vegan or vegetarian diets, pregnancy and lactation, and heavy menstrual cycles. Supplemental iron, 25 mg, may decrease the absorption of zinc, according to the odds. This amount is frequently found in supplements and could be advised in the event of a deficiency. However, this needs to be done under a professional supervision. Furthermore, using high-dose supplements may raise your chance of experiencing diarrhea, vomiting, nausea, constipation, and stomach pain. Even though these symptoms are not harmful, they are undoubtedly uncomfortable. The odds states that short-term consumption of even greater doses, 20 mg per kilogram, can potentially result in intestinal necrosis, particularly if food is not consumed. Zinc. In addition to being a potent antioxidant, zinc is necessary for some immune cells to activate. In the healing of wounds, it is also crucial. In certain populations, low zinc levels are linked to weakened immune systems and higher infection risks. Seafood, organic chicken, dark meat, cashews, raw pumpkin seeds, and chickpeas are foods high in zinc. Zinc intake should not exceed 8 mg for women and 11 mg for men aged 19 and over per day. Males and females aged 19 to 50 years old have a daily all of 40 mg. If you use more than 100 mg daily, you may experience side effects such as fever, chills, headaches, and/or an increased risk of prostate cancer. A copper deficit may arise from prolonged zinc supplementation. How to take supplements safely. When eaten in excess of the tolerable upper intake for prolonged periods of time, vitamins and minerals may become hazardous or even poisonous. Nonetheless, there are instances in which supplementation is required. One can cure a shortfall or meet nutrient requirements via controlled supplementation. When supplementing may be required, the Academy of Nutrition and Dietetics identifies the following instances. If your goal is to lose weight by reducing your energy intake. If your illness or lack of appetite is preventing you from eating enough. If you frequently exclude one or more food groups from your diet. If you are getting enough or too much energy, but not enough micronutrient-rich foods. A lack of micronutrients can also affect some groups more than others because of age, greater demands, or issues with absorption. These cohorts comprise elderly persons, expectant and nursing mothers, people with alcoholism, people adhering to strict vegetarian or vegan diets, and people with heightened nutritional requirements as a result of medicine or illness. You might require supplements if you fall into any of these categories. Consulting with a certified dietitian, ROD, is the best approach to ensure that you are taking supplements safely. They can determine acceptable dosage levels for supplements and evaluate your nutritional consumption. If you are unable to consult with an RD, you should speak with your physician and adhere to doses that include no more than 100% of the recommended daily allowance. To be sure the supplement you are buying performs exactly what it says it does and isn't tainted with other substances, look for third-party certified supplements. Third-party certification firms, such as NSF, USP, and Consumer Lab, are autonomous establishments that examine the production process of goods. Product testing and facility audits are two examples of this. The final word. In order to achieve dietary requirements and address micronutrient deficiencies, supplements can be utilized to fill up the gaps. There is an increased chance of deficits and inadequacies in some groups. But high-dose supplements, particularly fat-soluble vitamins, can be deadly if taken unsupervised by a doctor. You should speak with a medical professional, preferably a certified dietitian, before beginning any kind of supplement. And there you have it, folks. The lowdown on those 7 supplements you need to be cautious about. I hope you found this video insightful and eye-opening. Remember, when it comes to supplements, balance is key, and a little knowledge can go a long way in safeguarding your health. Before you go, I want to hear from you. Have you ever experienced any issues with supplements, or do you have a story to share? Drop it in the comments below. Let's start a conversation. Your experiences might just help someone else on their wellness journey. If you enjoyed this video and found it helpful, don't forget to give it a thumbs up and share it with your friends and family. And if you haven't already, hit that subscribe button and join our community for more health and wellness insights. But, folks, the information shared in this video is not a substitute for professional medical advice. If you have concerns about your supplement regimen, always consult with a healthcare professional. Thank you so much for tuning in to the Medical Minute. Until next time, take care of yourselves, stay informed, and be mindful of what you put into your body. This is the Medical Minute signing off. See you in the next video.